Erica, can you stop sharing and then we can get started?
All right. I guess we're ready now. Welcome, everyone. It's really good to have you all here. My name is Ligia Montano, and I'm with Senior and Disability Action. We are part of the California Care Rationing Coalition, and we've been presenting different events, such as the forum on skilled nursing facilities and the teaching on care rationing. So today we're here because we wanted to focus on what's going on in the nursing homes. For many reasons, this is a problem that has been affecting seniors and people with disabilities from before, but now with the situation that we're living with the pandemic, this is more evident. And so it's not just nursing homes, but it's also group homes, residential care facilities, psychiatry institutions, and other facilities and institutions. So we want to make sure that we can do whatever we can to find solutions together. So today we have Mike Dar from the California Advocacy for Nursing Home Reforms. Mike Dar is a staff attorney at the California Advocate for Nursing Homes Reform, where he provides long-term care residents with direct advocacy regarding issues including involuntary discharge, visitation, and discrimination. Connor is a nonprofit established in 1983 based in San Francisco, California. Mike?
Thanks for that introduction. Are you going to go through everyone's introductions and then we'll go to our pieces?
Yes.
Great.
No, actually, no, Mike, I'm sorry. I mean, when it's time for, now is your time. Sorry.
Thank you so much for that short pause. Thanks so much for having me, everybody, and such an important topic. I thought what I would do is try to just sort of set the table a little bit based not only on some of the voting issues that we're seeing playing out now in California, but importantly on things that were going on in long-term care in California before COVID and before this vote came up that kind of set the stage for some of the things that are going awry right now. And I think it's kind of useful to start out thinking a little bit about that pre-COVID world of whatever 150 years ago, if we can remember it, and how voting used to work back then, especially in long-term care. And P.S., when I'm talking about long-term care, I am focusing principally on skilled nursing facilities and on assisted living facilities, which is also called residential care for the elderly in California. There are also obviously many other types of long-term care in which residents may be affected by many of these same issues, but this is kind of my wheelhouse, and so it's where I'm going to start out with. And so before COVID, what we had going on was that many long-term care facilities, both nursing homes and RCFEs, were themselves polling places. And don't worry about the slides yet, I'll get to them. This is just like my preamble. It's like, so we're just getting warmed up. A lot of them were polling places, and a lot of them made it easy, for example, for residents who are ambulatory to go to polling places If they weren't in the facility themselves, they could go across the street to a church or to a library, go cast their ballot there. Many residents in long-term care didn't then and still don't have the facilities where they're living and getting care as their address for getting their ballot, for getting a mail-in ballot. And so before COVID, it was no big deal. You call up your friend or your family member and you say, go to mom's house or go to my house or go to my brother's house and bring me my ballot. You could also say if you had any disabilities or cognitive impairments or just needed assistance with a ballot, you could have someone come into the facility to help you out. And so, you know, while it wasn't as easy in some ways as voting if you were outside a facility, it wasn't so very different. And this is where COVID really changed the story in lots of ways. And you'll all remember that when COVID really first broke in March, what happened was throughout the country, nursing facilities, acute care facilities rolled out restrictions that you'd have to grant were kind of well-intended in that they were trying to prevent the virus from getting into facilities where people were very vulnerable. And there's no question that in principle is a good idea. But what happened practically was that many of those restrictions were very draconian, and they would say absolutely no visitors under any circumstances, even people who were providing care previously. They would say things like, you can't leave facilities and expect to go back because maybe you'll be bringing the virus with you. And what that precipitated over the period of some months and a lot of fighting was sort of a softening, an evolution in those standards, so that where we are now is that you have state and federal authorities both permitting visitation, even in facilities where there is COVID, and especially in facilities where there is not COVID, but basically making it theoretically legally possible for visitors to go in, and theoretically legally possible for residents of facilities to go out. And that sounds great, right? So we win, not so fast. What's complicated is that even though we have those rules now, and there's a lot of rules, is that lots of facilities do not obey them. And that's happening for a variety of reasons. One problem is that you have sometimes conflicting authorities between, you know, county departments of public health saying one thing, state departments of public health saying something else, the federal CMS saying something still different. And facilities will say, well, we're just trying to do the right thing and we're not sure whose rules we're supposed to be following. Those are the innocent explanations. And there's the less innocent explanations where they just said, we don't care what the rules are. We've decided that not letting visitors in is the right way to go. And who's gonna stop us? And so that's actually where we are now in California, probably in a lot of the country, where you have reasonably good new regulations, but you have poor, spotty compliance and poor enforcement. And by that I mean, if facilities aren't following the rules and someone goes to the state and complains and says, hey, how come they're not following the rules? The state doesn't necessarily act quickly to do anything about it. So that kind of is the landscape before we ever got to voting. So everybody started looking forward to the voting, the upcoming November vote, you know, starting say in August. And it weighed heavily on the minds of not just residents and their families and advocates, but politicians too, because this election in particular, probably above all other things, is a referendum on how well we are handling a public health crisis which has been a catastrophe for people who live in long-term care. And so the right of people who live in long-term care to vote on those issues is especially important to protect. And that's one of the reasons why we're here today. And the problem that we have now is, so we've also got pretty good new rules on voting after a lot of pain. So CMS, oh, actually we can put my slides back up. Where's my slides? Erica or someone, does someone have my slides?
One moment.
Yeah, no problem. If you have any trouble, I can kind of just roll through it. Okay, so again, just like before I get to the substance of the rules, and just looking at California, we have 1,200 skilled nursing facilities in California. We have almost 8,000 residential care facilities, also called assisted living facilities in California. So we're talking about hundreds of thousands of people whose votes may be affected by these visitation and voting rules that we're discussing today. So there's an enormous amount at stake. Let's go to the next one. So again, what happened is the different agencies that are in charge of oversight of the different skilled nursing facilities, assisted living facilities, and so on, started to issue rules under pressure by organizations like the ones on this call to try to ensure that people living in long-term care could vote, could exercise their right to vote. Let's go to the next slide. Sorry, here we go. And so the best of that work, this is probably Susan's hand involved, is the memo that's been issued by the feds, by CMS, which specifically says that facilities, these are nursing facilities, which is what CMS oversees, should provide residents with assistance completing a ballot, including, and this is really important, an agent, a person of the resident's choosing. This could be a family member, this could be an ombudsman, this could be someone working at the nursing home. So that's good, right? It's very, very protective of resident rights. Let's go to the next one. We've got California Department of Public Health issuing its rule, which is much more not as strong as the CMS, but does provide sort of a good recitation of the different rights that residents of nursing homes have, including the right to get assistance in completing a ballot, including the right to go to a polling place. And I'll get to my point in a second. Let's go one more slide. And finally, this is the Department of Social Services in California, which oversees assisted living facilities. This is their version. And their version too does a reasonable job of sort of saying what rights residents have and sort of saying that they shouldn't be infringed upon. Here's what none of these rules do. None of these rules grapple with the conflict that will happen between these rights to have an assistant come in, to go out maybe to a polling place, and what we're seeing in terms of these visitation restrictions. Because the reality on the ground in California, like I said, is that many facilities are still allowing no visitors. Many facilities are doing things like locking people out, meaning, okay, resident, if you want to go across the street to the library, you can, but you can't come back in, we'll lock the door because you might have COVID. So the problem is, how do you reconcile these rights which are acknowledged in the CMS statement, in the Cal DPH statement, in the DSS statement, and what's actually going on the ground in terms of facilities permitting adequate visitation, permitting people to go out. And the fear that I have is that there is so little time between now and the election that the normal complaint and administrative processes for resolving conflicts like this, you write a complaint, it goes to the agency investigates it. Maybe they send an investigator to the facility to interview people. That will take months, and we have only weeks. And so how do we ensure that if conflicts like this exist or will come to exist, that they can be resolved in time to protect the rights of residents to vote? And so I'm very eager to hear what Susan has to say on these points, but what I'm suggesting to residents that I talk to is you have now a bunch of different rules that are very helpful for different kinds of facilities. Show them to the facility administrator and say, are you following these rules? Will you let me have an authorized representative come in to assist me, for example? But do it now. Do it very soon, like in the next few days, so that if they say no, we can try to get the regulators to resolve the conflict in time for people to be able to go out and vote during the election or to send in their mail-in ballot. So that's my big point. I'm happy to talk more about this, but I want to leave lots of time for other speakers.
Thank you, Mike. That's really helpful. Thank you so much. Now we're gonna hear from Erica Clare. Sorry, I probably mispronounced your name. I'm really bad at that. From Hand in Hand. Erica is from Hand in Hand, and she's one of the national organizers of the Domestic Employer Network. Hand in Hand is a national network of employers of home care attendants, house cleaners, and nannies who believe that dignified and respectful working conditions benefit both workers and employers. Erica, would you like to share with us?
Thank you so much. Excellent pronunciation, Sklar. Very good. It's a tricky one. I'm going to share my screen. I just have one slide. And I'm going to actually back us up a little bit and talk about the history of voter suppression in the United States. I see that Susan was hoping that Mike has the answer, and I was hoping that Susan would have an answer for us too. And I think that, you know, voter suppression and making sure that people can vote safely is something that we're going to continue to be grappling with for a long time. And it's something that we've been grappling with for a long time. The United States has a very long history of voter suppression, and I'm not going to dig really deeply into history because we have a lot of present things to talk about. But I'm going to say a few things about history and how those things interact with what we're seeing right now. First, it's really important to name clearly that voter suppression has always been inextricably linked with race. It continues to impact Black and brown voters, as well as cash poor and disabled voters, more than white voters today overall. There are things like literacy tests, poll taxes, that unfairly limited access to voting for Black people in the very same ways that we're seeing things today, like people who are being purged from the voter file, so removed altogether from the roll, and closing polling locations today. These things are similar. What's happening today comes from the history and the legacy of racist voting policy. Similarly, I think we see how ableism continues to impact voters with disabilities who are often barred from voting illegally by election officials at their polling locations. So it's important to note that in many states, the only person who can determine if a person is eligible to vote is a judge. However, an election official in many states can refer voters out of the polling location, in which case they have to find a judge to determine. So I think there is a lot of discrimination that happens. And I think hopefully somebody on the call who's more knowledgeable about the intricacies of these details, which vary state by state, will be talking about that. I also want to highlight the impact of mass incarceration on voting and restoring voting rights to incarcerated and formerly incarcerated individuals. This continues to change outcomes of elections. One example that we see right now, is happening in the state of Florida, where about 1 million formerly incarcerated individuals should have the right to vote. Voters approved a constitutional amendment to this effect, but the Supreme Court ruled recently that anybody who should have their voting right restored actually has to pay in full all of their court fees before they're able to register to vote, which is basically imposing a poll tax. 1 million people is a very large number, and that number could change the outcome of big and important elections. So there are efforts to pay those fines and fees. It's called the Florida Fines and Fees Fund. If you go to wegotthevote.org, you can find out more about that. Another issue of voter suppression that we're likely to see in the coming months is the closure of polling locations. We've already seen this in Texas. That was just upheld, that there can be only one voter drop box, so mail-in voting drop box in each county, including counties that would include, for example, the whole city of Houston. We're seeing really long lines in Georgia. People waited 10 hours yesterday to vote. We're, in the middle of October here, we're not even on election day. And of course, back during the Kentucky primary, there was only one in-person polling location in Jefferson County, which includes the entire city of Louisville. Those long lines increase the likelihood of COVID transmission. It's very hard to stay 6 feet apart if you're in a line that's as long as those are. And I think it's just important to name that that's no coincidence. This county is the county where a full 50% of Kentucky's Black population lives. So this year, there's been a huge push for more poll workers to apply and become poll workers, or more people to apply and become poll workers, but there have been more limited resources and generally fewer poll workers. Hopefully we'll see that many people are volunteering their time to be poll workers this year. But this is, clearly also deeply interconnected with the fight for disability justice. In 2018, state officials in Georgia invoked the Americans with Disabilities Act to close down polling locations that were deemed not compliant with ADA regulations, which, seems on the one hand like it would be a good thing, but actually it made for fewer polling locations, and that was done very strategically in mainly majority Black neighborhoods. Also in 2018, according to the Government Accountability Office, nearly 2/3 of the 137 polling places that were inspected on Election Day back in 2016 had at least one impediment to people with disabilities. So that's over 60% of polling locations last presidential election that were not fully accessible. I think when we add the layer of a global pandemic onto what we've already seen, we know that a lot of people are going to be concerned going to the polls. So keeping people safely distanced on election day is going to be difficult, especially if we're looking at fewer polling locations and long lines. A couple other things I want to name. We couldn't talk about voter suppression if we weren't talking about recent changes to the United States Postal Service. We know that voting by mail has been proven to be extremely safe and very secure. States like Oregon and Washington only vote by mail. And I used to live in Washington, and what a pleasure to sit with my cup of coffee and all my voter guides and do my research. And hopefully some of you all have had that great experience this year by voting by mail. But we do know that there are some delays on mail delivery and some uncertainty about how safe voting by mail is. So it is very important to weigh the options where you live as you develop a voting plan. You know, vote by mail will continue to be safe and secure for most people. And thinking about how early you'll get your ballot returned or postmarked is crucial. And also just want to name that mail-in voting is not the most accessible option for many, and in fact, is not at all accessible for some. So just want to sort of underscore having a plan, sticking to the plan, having a contingency where it's necessary as well. And the last thing that I want to talk about is the issue of housing and housing insecurity. Voting requires an address for people who are facing housing instability right now, which of course includes a huge number of domestic workers, people of color, folks with disabilities. You know, voting is not necessarily a sure thing. If you're worried about eviction or you move before your ballot arrives, if you move and you don't know, you don't change your registration address, the polling location is across town, you didn't make it, or you didn't realize that you never changed your address and there's no way you can get to the polling location, maybe you're not on the roll and you don't know why. You know, there's a lot of reasons that people can really struggle to vote as a result of housing insecurity. And we know that, you know, we're seeing some extensions on eviction moratoriums. Where I am now in Richmond, Virginia, people are being evicted every single day. And I think the reality of housing insecurity, and especially during COVID, is that life is really chaotic for many people. And we don't want to throw people under the bus for not voting when they're trying to figure out where they're going to sleep at night. We want to encourage people to vote in whatever way is possible for them, but also recognize that we live in a system that makes voting really difficult for many people. So I'm going to go ahead and stop there, but happy to answer any questions and encourage each of you to think about your plans and game out how you're going to help other people vote, how your vote is going to count this year, and make sure that we don't see so many suppressed voters this voting season. Thanks so much.
Thank you, Erika. This is great. I mean, we have very great speakers, and together we're going to come up with the best solutions, right? So now we have Susan Mixner, Director of Disability Rights Program at ACLU. Sorry. SDA has had the pleasure of working with Susan extensively. She's an incredible attorney, advocate, and member of this disability community. So we're gonna hear from Susan now. Susan?
Thank you so much. And thank you, Erica and Mike, for your presentations. I'm gonna share my screen, I hope, and just quickly go through a few slides here. I think I should actually, can everybody see my screen?
Yes.
Okay, great. So I was just going to cover what Mike already beautifully covered, which is that in the past, people in nursing homes and other congregate settings were able to vote more easily because polling places were located in many of the congregate settings. Because the Help America Vote Act requires every polling place to have an accessible voting machine, they were on site for people who had what we call print disabilities, disabilities that involve not being able to read or manipulate print. You're either blind or you have manual dexterity issues and can't mark your ballots. Accessible voting machines allow you to do that much more easily. And for those who needed assistance, even with an accessible voting machine there, the League of Women Voters and other groups went to congregate settings to assist people or offer their assistance if they wanted it. As Mike has pointed out, now because of COVID, all of these places are locked down. No one's heading out to them. And absentee or mail-in ballots are the primary mechanism that people are going to be used to vote. And absentee ballots are paper ballots. They are not particularly accessible. There are 1.3 million people in nursing homes, another about 800,000 people in other congregate settings around the country that receive Medicaid or Medicare funding. And many of these people will not be able to cast a ballot privately and independently. So the goal that we had at the ACLU and with a bunch of disability rights groups, including the National Disability Rights Network that Michelle is joining us from, was to make sure that the federal government alerted nursing homes to their obligations in other congregate settings, to their obligations to assist their residents to register to vote and to be able to choose whom they wanted to get assistance from if they needed it. So just to give you some legal background, the Voting Rights Act, one of our oldest voting rights laws, specifically specifies that any voter who needs assistance because of a disability may be given assistance by a person of the voter's choice. And they've got a caveat that it can't be the voter's employer or agent or the employer or agent of the voters' union because of concerns about coercion there. There's some states, again, I'm from the National ACLU, so it doesn't apply in California as far as I know, but there's some states that restrict a nursing home staff member from assisting someone with voting because they're worried about coercion there. Here, I just want to be really clear that federal law trumps state law. If the individual in the nursing home feels that the person they want help from is a staff member and that's the person they trust, that's who should be able to help them vote. There's also support from the Americans with Disabilities Act, Titles 2 and 3 covered entities. That includes state and local governments and private and publicly funded nursing homes or other congregate settings must provide reasonable modifications in order to provide people with disabilities an equal opportunity to participate, and that includes registering to vote and casting a ballot. And finally, there's also a section in the Code of Federal Regulations that speaks specifically to the rights of residents in long-term care facilities, that not only must they be free of interference and coercion, but the facility staff, the facility itself, must support the individual in exercising his or her rights, which includes the right to vote. So, summary, what do all of these laws mean? We're very clear that residents in Medicaid and Medicare funded facilities, I think also in veterans facilities, have the right to choose whom they would like to help them vote. And that right includes having someone from outside the facility come in to vote, as long as they follow proper infection protocols. It also means that facilities have an affirmative obligation to help residents who wish to vote. And they should help them in registering to vote, in whatever mechanisms of help they need in terms of getting their ballot filled out and sent in, and for the few residents who might actually want to go to the polls, getting to the polls. So how do we realize these laws? I just started writing these these slides once I heard Mike was hoping for answers from me. The American Bar Association has a very clear standard, which we support, of who should be able to vote, and that's any voter who expresses a desire to vote. Voter means someone over 18, US citizen, otherwise eligible to vote. If they express a desire to vote with or without reasonable modifications or accommodations, should be given the opportunity to vote. And here, the with or without reasonable modifications modifies both the desire to vote, if they express this through assisted communication technology, through sign language, through motioning, and whatever way that they've expressed their desire to vote, and how they vote also needs to be provided reasonable modifications if they need assistance. I would say that we should also be asking, in addition to Michael's questions, we should also be asking residents if they would like to vote. We should be asking nursing facilities, have you gone to every resident in the facility and asked them whether they would like to vote? Have you helped every one of those who want to vote to register? And what are you doing to ensure that if they need assistance, they're getting assistance from someone they choose and that they trust? Election hotlines are one avenue if we are hearing of problems. The 866 Our Vote is a huge, broad election hotline. People are trying to staff really well, thoroughly. I think it's 9 to 5, Monday through Friday, and would be your first stop for people who are English speakers. But I've also listed hotlines for people who speak other languages, and then the ARC's Voter Support Service for people who may have intellectual disabilities. And then the guidance from CMS, which Mike has already put out. So I'm going to stop sharing, I hope. There we go. And move on to our next speaker, Michelle, I hope. There she is.
Thank you, Susan. Yes, we do have Michelle Bishop. She's a voter access and engagement manager at the National Disability and Rights Network. Michelle?
Thank you. Hi, everyone. Well, you can tell I'm coming to you from the East Coast by this really interesting mood lighting around me, casting a shadow onto the wall. It's almost 6 o'clock in the evening here. But thank you so much for having me. I'm so excited to join you all. What can I say? After everything we just heard from our amazing speakers, especially Susan Mixner, who I'm a huge fan of, as a matter of fact, she knows that. And I just want to stress that everything that we talked about today, what we're really talking about, these are federal laws. These are the civil rights of these voters. You have the right to vote, even if you're in an institutional setting, unless you have been found through a court to be incompetent to vote, which in California is a more difficult process than it is in many other states. These are voters who have the right to vote. They have the federal right to the assistant of their choice, and the institutions and residential and long-term care facilities in which they're living have a very real obligation to ensure that they have access to the vote. And that does mean asking residents if they want to vote. That does mean making sure that absentee ballots that show up in the mail are delivered in a timely manner to those voters, assisting voters to fill them out if they want your assistance, and making sure those ballots are returned in a timely manner, which we know doesn't always happen in these types of settings. This is something we're really concerned about in 2020, the COVID-19 election, because as you heard from some of the other speakers, we traditionally have a lot of ways of getting around some of the problems with helping people to vote who live in long-term care facilities, like having polling places situated in these types of settings, because they're, well, actually usually fairly accessible even for people who live in the surrounding community who are going to go to vote there. But it means that for the residents, all you typically have to do is get to the lobby, and there's going to be an accessible voting machine there for you and poll workers there to assist you. We also typically have programs where county elections officials go into these types of facilities to make sure that the residents who are eligible and want to vote get a ballot, to help them complete it, to return it for them. That is still happening in some places, but we know that it's not happening this year in others because of COVID-19. So it's really critical that we're paying attention to these issues and we're making sure that residents are able to vote. And I want to just say, make no mistake about it, this is absolutely a civil rights issue. When we talk about access to the vote and the right to vote, it's very much that important. But when we're talking about people who live, particularly in long-term care and residential facilities, this is inevitably a disability justice issue. we are by far talking about people who have disabilities. They may not identify that way. As we know, very often when we acquire disabilities later in life, we just call it, and I'm going to put finger quotes on this, getting older. I don't see as well as I used to. I don't hear as well as I used to. My hands aren't as steady as they used to be. What we're talking about is people with disabilities, people who have access needs. We're talking about a disability justice issue in the way that we administer our elections. We're also very much talking about racial and ethnic justice. We know that the percentage of racial minorities in long-term care facilities and nursing homes and residential facilities has been increasing for at least the last decade. There is a significant percentage of residents in residential facilities who are Black, Latinx, American Indian, Alaskan Native, Asian American. This is very much a racial justice issue when we look at access to voting in these types of facilities, and it's also an economic justice issue. A large percentage of these residents are people who, for one reason or another, don't have access to another type of care. Maybe the Medicare and Medicaid system has shuffled them into a facility. They don't have family members who can afford to support them at home. So we're talking about disability justice, racial and ethnic justice, economic justice. These are core civil rights issues, and we're talking about the voices of those voters being heard in this election. And in particular, when we talk about these types of facilities, we're talking about a type of voter who's already experiencing lower social engagement. By the nature of living in a residential facility, these voters are less integrated into the broader community. And we know there's a very real correlation between your integration into your community and your likelihood to vote. People who live, work, and play out in the community are more likely to express that citizenship on election day than someone who lives in any type of institution or long-term care facility. So there's already reduced social engagement. And to put an even finer point on that, we know that there is lower social engagement among racial minorities who live in these facilities, to again just stress the intersection of disability justice and racial justice when we talk about access to the vote in long-term care facilities. There's also lower engagement with political campaigns, political parties, and get out the vote campaigns. They are geared toward people who are living in the community. They're geared towards students who live on college campuses. They are not geared towards people who live in nursing homes or any type of residential facility or institution. So not only are they less likely to be experiencing full social engagement with their community, but they're being excluded from get out the vote efforts that would not only encourage them to vote, but ensure that they have access to the ballot. Those get out the vote campaigns are usually in crucial measure in ensuring that people are aware of deadlines to register or apply for a mail-in ballot, of making sure people have rides to the polls. And people who live in long-term care facilities are largely excluded from those efforts. So it's really important that we as a community, and I'm talking about people with disabilities, advocates, service providers, are filling in that gap and ensuring that people who live in long-term care facilities are receiving that contact. Someone has talked to them about how important their vote is, made sure they know all the important deadlines, asked them if they need help registering, applying for a ballot, whatever it may be, because we can't rely on them getting those contacts elsewhere. The last thing that I'll say in regard to that is that this is also the COVID-19 election. And when we talk about people who are living in residential facilities, we are largely talking about people who are at the highest risk for complications related to COVID-19. These are the folks who we often call the most vulnerable when we listen to news coverage about COVID-19. These are the people who are relying most on their elected officials to help us to navigate this pandemic, keep them and their loved ones safe. They are relying on whoever will win these state, local, and federal elections to keep them safe from COVID-19. It's critical that their voices are heard now more than ever before. So I just want to stress that failure to really engage people with disabilities living in residential facilities will exclude their voices from being heard in their democracy. And that, above all else, is a civil rights issue. Thank you.
Thank you, Michelle. Like I said before, together we're gonna find some solutions to this. And right now, this is the first thing that we were thinking that you all can help with. And in the chat, I just put a link that has the fact sheet of the voting in care facilities. You know, it has all the points, or most of the points that have been made by our speakers right now. And we would like to have all of you, you know, as much as possible, to distribute this to everybody you know, to everybody that care about, you know, this election. And I think most of the American people, most of the, even the world, care about this election. So please, please distribute this wide. And we also have a sample letter that you can find in this other link. There is another meeting happening in this chat, you know. So if you have access to your chat, check on everything that people have been talking about. You know, they have a lot of insight about all the things that are happening in relationship to these issues. And now we're gonna go to the session on questions and answers. And Mike has a couple of comments that he would like to make in reference to some of the questions that he saw on the chat. Mike?
Yeah, thanks for that. So just a couple quick things for us to be thinking about as we sort of chew through these issues. One observation, again, this is all sort of based on the ground advocacy in long-term care, is that the problem by and large in California and in other states is not that there aren't enough regulations or enough rights under federal or state law to protect people. It's that they're not enforced. There's poor enforcement at the state level, there's poor enforcement at the federal level. Sorry, I'm starting my video because you don't want to miss this. And so it's great and satisfying on one hand for us to be able to identify the rights that protect people on paper, but the rubber hits the road where we have to figure out how in a month we can ensure that facilities that do not follow the law are held to it without the usual complaint process that we use to try to get those issues resolved. That's one huge problem. Another is that a lot of the solutions that we're talking about, even sort of broadly, involve staff engagement at long-term care facilities. Most staff, especially at nursing homes, are CNAs. They are not nurses. You know, you might have one director of nursing. You maybe have one doctor who's probably not even at the facility. Those CNAs are working for very little money, and they're seeing 10 or 12 or 15 residents an hour. And if you add on top of that, you need to help people register. You need to make sure that you assist people with their ballots if necessary. Part of the pushback is going to be they just don't have time to do that. They already don't have time to give people their medication. So in thinking through practical solutions, it seems like getting outside assistance into facilities safely with good PPE is going to have to be part of the solution. So thanks.
Thank you, Mike. This is the section on questions and answers. So if any of the participants has questions, please go and either unmute yourself and show your video, please, if you can. Or you can also, if you're on the phone, press *6 to unmute yourself and ask your questions. And I think it's *9 to raise your hand on the phone. Betty has a question, right?
Yeah, my question was the League of Women Voters, are they by any chance this year helping in the nursing homes? Yeah, League of Women Voters.
I can
Sending
offer
volunteers.
my little bit of understanding of what's happening in California, which is you have organizations like the Gray Panthers, like the League of Women Voters, who would like to help, but they can't get people into these facilities. Even ombudsmen, especially volunteer ombudsmen, are often not going into these facilities. And so it's a very difficult problem.
Yeah, okay.
Thank you. Any more questions? I'm pretty sure you have a lot of questions. I mean, how you can help? Again, let's share that link. And you know, I'm big on making people work, so let's do it. That's the link where we have the fact sheet, and you can print it and send it to your friends or give it to them when you walk, or you can send it by email. There's a lot of stuff that you can do with this, and it has a lot of the points that our great speakers made. And so you're gonna find that very useful. And any more questions from you guys? We have 49 people, and I'm pretty sure there's a couple questions there.
Hi, honey.
Okay, go ahead.
Hi, darling.
I don't think it was meant for you, Mike.
There's something going on here, darling. The dog's barking. Hold on, please. What is? Oh. They want me to speak?
Oh, are you speaking? Do you want to? Who's that? I'm not sure. I cannot see the video.
It's Danielle Thompson. Are you trying to ask a question, Danielle?
No, my daughter was asking me. Can you hear me? I don't know whether I'm on this correctly.
Yes, we can hear you.
Okay, good. I did have an experience in a nursing home almost 2 years ago when I broke my hip. And everything you've said about not enough staff, they're working themselves ragged. I did have actually a very good experience there. I found everybody to be really lovely. But I did wonder why there were no volunteers as there are in hospitals. And I wondered whether there was an organization that could volunteer, people could volunteer as they do in hospitals, you know, help with doing people's hair, bringing magazines, bringing books, that sort of thing, another friendly face, etc. And I just wondered if there was an organization and whether they do that. Obviously, during COVID, this can't be done. So we're talking about the future again, aren't we? However, I just wondered, do you have an answer for that?
Any of you, Mike, Michelle?
I do have a quick one. So there certainly are organizations, there's groups like Little Brothers, Friends of the Elderly, that have been around for 80 years doing work like that. There are more on the advocacy side, ombudsmen who have a formal role as advocates for residents. That's not exactly what you're talking about, but they're important too. And just before leaving the topic, I mean, a lot of the family visitors that were coming in people think, well, that was important emotional support. Of course it was, but they were providing a lot of the medical care, the health care. They were washing hair. They were making sure linens weren't dirty. They were making sure people got medication, and they're locked out now too. And so conditions inside these facilities are very bad. So unfortunately, it's a tough issue finding people, especially right now, who are able to get into nursing homes, especially.
Right. I found the physical therapists to be extremely professional and fabulous. And I thought, well, where is the level? Where is that level with nursing staff? And of course, there isn't a level like that. So that was disappointing. But they were a great sort of go-to as a support system, and also because, you know, when you start working with them, they're there every day, they're getting you up, you know, so there was a lot of energy from that point of view. However, there was a lacking, you know, there was definitely a lacking, but I did find the place that I was in to be very friendly, and they were very nice people, all of them.
That's great. That's great, but I think there's also different levels of on the nursing skills facilities, that they're not all the same, and you know, especially those that tend to have more medical patients. You know,
Right.
I'm not sure about that, but Mike, would you care to elaborate a little more on that? You know, if you've seen any difference between, you know, what happened in nursing facilities that are privately owned, or those that receive medical patients or medical residents?
Yes, this was a Medicare type facility.
Yeah.
Hi, my name is Jamie. That's my mom talking. And about the voting issue, I mean, this was a few years ago, pre-COVID, and my stepfather, so we were in Silver Lake in Los Angeles was her facility, and my stepfather had to go to downtown, get a ballot for her, spend a couple of hours, you know, and get special permission and bring it back. And go through, you know, spend basically the whole day trying to figure out how to make sure that she voted. And so, you know, and I was there at the tail end when she got her ballot into the facility, but it was a whole ordeal just to make sure, because the nursing home did not facilitate that at all, right? So my stepfather took the entire day off of work to make sure that she got her ballot. And had we known at that time what her rights are, but you know, no one was talking about it. None of the folks that at least I saw when I went to visit her were facilitating any kind of voting, or, you know, there was nothing up posted about her rights to vote. But my mom, being the strong voter that she is, right, and always voting and being really involved and, you know, a volunteer, wanted to make sure that she got her ballot cast, but she had to be incredibly proactive in that process. So sorry, Mom, but I just wanted to share.
No, you're right. I didn't. Yeah.
Thank you for sharing that. We have next Paul Hanlon. I'm sorry, I cannot really say that last name.
Hi. Yeah, no, it was Paul O'Hanlon. Hi, I'm wondering whether any, well, first off, I'm from Pennsylvania. We have kind of two large categories of long-term care: nursing homes, which are probably the same in every state, and something we call personal care homes, which are non-Medicare funded kind of board and care homes. And and every one of them, you know, everybody in them probably qualifies as being a person with a disability. But personal care homes are more likely to have people with chronic disabilities. And what I've been struggling to find is if there's any data on the percent of facilities that are connected by Wi-Fi internet service, that how, you know, we're at the point where mail is so kind of risky at this point. You know, if you're applying to, you know, if you're registering to vote, applying for a mail-in ballot, the whole process now is so close that it really begs for, you know, instantaneous computer-based, web-based kind of registration and things like that. And I can't get any data on, number one, whether there's universal connectivity or not. My suspicion is that it's not. And then secondly, whether there's any effort to use any of the CARES money for, you know, addressing the lack of universal connectivity of people in long-term care facilities, because it really highlights a chronic problem. So that's my question.
Thank you. Before we answer that, we're gonna switch interpreters, ASL interpreters. Can somebody help me with that? Okay, great. Thank you. Sorry about that. Is any of you, Mike or Susan, have anything that you can share about that question? Michelle, anybody?
Sure, I can say briefly, I can tell you that virtually all nursing homes have connectivity, and I would be surprised if there was no connectivity in group homes. And you bring up a very good point, Paul, because most states now allow people to register online. And that is something that volunteers might be able to do remotely if there was just an iPad or phone or something that staff can give the resident outside of the facility. One can go to the website and walk the person through the form and fill it out with them. So that would be helpful for registering to vote. It still doesn't get you to voting, but registering. And in California, our remote registration deadline is coming up October 19th, I believe, right?
Yeah, and I was just going to cap on something Susan just said. So already there are requirements that nursing homes especially provide what are called alternative means of communication, by which they really mean iPads and the like. And those requirements have existed for many months in reaction to the restrictions on visitations that we have all suffered through. So it's certainly possible that those kinds of you know, laptops and iPads and stuff should already exist in many facilities. One concern that has been raised even about them is the hygiene and sanitation risk of passing, you know, an iPad from one resident to another, to another, to another in a facility. But, you know, that shouldn't be impossible.
Thank you both.
Well,
we have one.
I have one follow-up question. I know that in Pennsylvania, we're for the first time having some voting mechanism for blind voters where they can essentially download a ballot. And it makes me wonder whether that or something like what's afforded to overseas voters, you know, it seems to me that you know, this situation begs for an extraordinary measure for how, I mean, we're talking about a gigantic number of people. And, you know, so again, is there, I'm struggling for kind of practical solutions, because I think that this is a real huge problem, and it's really hard for me to figure out how to solve it.
Susan, Mike?
I can add a little something to that. The types of solutions that you're talking about in Pennsylvania, we are seeing a sizable increase in those across a number of states. And it's not particularly new technology. For one of the reasons you brought up, it is a technology we use to get ballots to overseas voters, but it's also a little more common in your vote by mail states, your traditional vote by mail states, some of California's neighbors, states like Washington, Oregon, Colorado, where you can receive your ballot electronically. And I know that there is a California system as well. I think it can be immensely powerful. For one, traditional vote by mail systems are exactly what they sound like. They are mailing someone a piece of paper, and we know that that piece of paper that has to be marked by hand is just not accessible to everyone. So the ability to send it to someone electronically can be very powerful. A couple drawbacks to that: they typically require that at some point in the process you're able to print out and return a paper ballot, which one introduces some inaccessibility back into the system if you can't read or handle that paper. But the other concern that we have with these types of systems is that it's not a complete solution. That alone won't solve all of our problems. One, if you have to print that piece of paper, I don't know about y'all, I don't even own a printer. And I don't know what access to a printer might look like in some long-term care facilities. I can imagine that could be a little more complicated, but it also requires that voters who want to use it have access to their own technology. That's something that concerns me about voters at home as well as in long-term care facilities. Do they have a computer, a tablet, a smartphone, reliable either internet service or cellular data service to be able to access it? And then exactly what you're asking before, what does that look like in some long-term care facilities? It could very well give a greater number of people access, and for that alone, I think it has a lot of value. But I think exactly what you're saying, we have to also keep looking for some other practical solutions as well if we really want to assure access to the vote for everyone.
And that's exactly what we're going to be doing next. So we're going to have our breakout rooms, and in there, you're all going to have the opportunity to share what kind of action you're going to be taking to help to make this an accessible voting day or voting, year for nursing skills residents. So when we're ready, we're gonna go and share all of our plans. Jessica?
So, thank you so much, Lihia. Thank you also to all of our amazing speakers. So we are experimenting with Zoom's new feature that people can actually choose what breakout room they want to be in. And if you're on the phone or you can't pick a breakout room, no worries. Stay here for a second. Just hang on until people go and we'll put you in the room of your choice. But the rooms are, the first room is going to be for ASL and captioning and anyone who needs those. And that's going to be to talk about the kind of general topic of what do you want to do to make sure people in facilities can vote this year. Second is family members and friends, either what can you do or what do you think other people can do. Third is legal advocacy. Fourth is outreach to facilities. A couple people have put in the chat, how do we contact facilities in our area to make sure they're taking action? Then we have outreach to staff in facilities. How do we talk to the staff and make sure they're doing what they can? Then drop off and pick up information and ballots. So do some strategizing about how do we get fact sheets and resources to facilities, and how do we get people to drop off their ballots if needed. And then research, so that might be research on what facilities are out there that may need some information. And then the last group is a general outreach and advocacy group. So you can go ahead and choose your room. You'll have about 8 minutes to come up with some ideas. Looks like we've had a few people move.
How do we move?
So actually, if you're having trouble, if you're not, so ideally you'll get something on your screen that gives you the option of where to go. If not, I can move you.
Yeah, I didn't get anything on my screen and I don't know how to get in the room.
Oh, I'm so sorry about that. That's strange that that's not working. If I do, nope, that doesn't work. Okay, do people know what room they want to be in, or do you want me to just assign you?
Assign us.
I know what my
Time.
I'm sorry, what was that?
This is Carla McLean. I would like to go to the outreach and facilities room.
Okay, who else wants to go to outreach to facilities?
That would be good. I will.
Say your name if you want to go to outreach to facilities.
Danielle.
Jacob.
I got Danielle and
Julie
Jacob
Schneider. Julie Schneider.
and Julie. Okay. Okay, who wants, I'm sorry, Alan Cooper wants to go to outreach to facilities. Okay, that room is full. Who wants to go to family members and friends?
I would.
That is Eric.
Emily Bridges.
I'm gonna put all of our phone people there because that's just the way it's gonna go. I'm sorry, who else for family members?
Emily.
Connie?
I'll go to that one, Jessica. This is Mike Darp.
Great. Anybody else for family members?
This is Emily, and I'd like to go there as well, please.
Okay, great. And I think that's the last. Who wants to go to research? Okay, who wants to go to dropping off or picking up information on ballots? Okay, I'm gonna put everyone else then into outreach and advocacy unless if anyone else has a preference, go ahead and tell me now.
Is there a legal or something?
There is, who's that?
Oh,
Paul wants to go to legal, perfect. Anyone else for legal? I'm putting the Disability Rights California folks in there. Melanie Grossman, do you have a preference?
Yeah, I'd like to go to legal.
Okay. Sheila, do you have a preference? Okay, Sheila, I'm gonna put in research. Okay, everyone has 60 seconds to come back. Uh-oh, did some of you not end up in a breakout room?
Oh, I wanted to stay in the legal breakout room. I was mid-sentence, but that's okay. I think it's done.
It kicked you out.
I kicked myself out when I clicked the wrong button.
Oops, sorry.
It happens.
Welcome back, folks. If you are coming back from a group, go ahead and put some comments in the chat about some of the ideas you have for actions to take.
Oh, darn it. I accidentally, this is Carla McLean. I accidentally left my room, I guess, and it sent me back to the main.
Oh, sorry. I think we closed the room, so everyone should be back. Please go ahead and start putting in the chat some of your ideas for actions to take. And then Likia will facilitate hearing from each room.
Okay.
Hi, everybody. You know, I wanted to apologize before I continue with this part because I didn't realize that in my room, in my breakout room, we have more people, and Michael and I, we were just talking about the stuff that we were gonna do and some other things and planning for tomorrow, and didn't realize that there were so many people there. Sorry about that. But if we can start with the groups, can we hear from the first group was the ASL group?
Sorry, that room was empty.
Oh, that was empty. Okay. How about the legal advocate group?
I'll just report back that
Okay.
the Disability Rights California folks were there and said that they have a hotline. But in terms of Melanie asking what could be done immediately, we agreed that given the short timeline, calling nursing homes and other congregate facilities directly, asking them what they're doing and getting that answer back to the Disability Rights California or the ACLU is probably the most efficient and needed step.
Thank you. Thank you. How about the outreach? That was our group, Michael. Was it?
Was that my group, Ligia?
Oh, was it? Okay, go ahead, please.
I was actually with Connie and Emily and a few others in the group about family and friends and what we could do. And we're basically on the same page as Susan about first, the necessity of educating residents in long-term care of the rights they already have that exist, but they may not know about. And then second, in teeing up a conflict, if there is going to be one, with facility administration to see whether they will comply with these laws. Susan's suggestion was to go to advocacy groups. I think that's a great idea. The other suggestion is to go straight to the regulators who are expecting this question to come up. And the related point that Connie made in our group was that pressure on local officials who may have family or friends in facilities locally could be really useful in trying to get stuff done.
Great. Thank you. Michael, would you like to share what we say, and maybe someone else from that group, if you guys wanted to share any ideas that you have? And again, sorry for not, knowing that you were there.
Thank you. Yeah, I apologize. We also couldn't unmute the people who were in our breakout room. Yeah, so we discussed the issues of linking voting rights in nursing homes and congregate facilities with other rights such as visitation. There's a friend of SDA who can't visit her 103-year-old mom in a nursing home. And so it seems like voting rights in nursing homes is like kind of a proxy for all kinds of other rights of people in nursing homes. That's all.
Bill, CV, I like I said, I apologize again. And if you would like to share anything, what kind of ideas you have, I didn't realize, and it was on me, and I'm really sorry. I have a couple comments here from Paul. It says that my experience is senior advocacy group, mostly service providers, and AARP, good government groups like the League of Women Voters, Common Cause, weren't eager to complain about the barriers to voters in long-term care facilities. We need to be talking to more than just the state. Carla said that wasn't able to make a contribution in the breakout room in the facility. However, I wanted to throw out that since there are so many people to reach, it is easier to have a one-to-many relationship in the solution. For example, when you taxes this day, you no longer have to sign your tax form if you have used a secure federal PIN number. If advocates could send proof for voters residing in facilities, the PIN number instead of voter signature could be used to sign ballots. Just a thought. That's a great idea. Okay. Okay. Sorry. Anyone else that would like to share or read what they wrote?
So I just put up a quick question. Are you able to help with outreach, research, or other follow-up from today? Because it's so wonderful that we have folks here who are really committed to reaching out to people in nursing homes and group homes and other kinds of facilities. And we want to be able to follow up together and be as effective as possible. So just hit a quick yes, maybe, or no. I hope that showed up on people's screen. It should have. And then we can follow up with you. You can also put in the chat, put your email or phone number, whatever is the easiest way to contact you. And I want to invite people to share their video. We're wrapping up in the next 5 minutes. I know people have a lot to say on this topic, and we definitely want to continue that in the future. But we also want to be respectful of people's time today. So please share your video for the last few minutes so we can see each other, and be sure to click yes, maybe, or no, although something happened with the polling. I'm going to try that again. Okay, thanks. Ligia, it's back to you.
Okay. So we also, well, thank you for participating in all this. I have a couple of things that I actually have. Peter, are you here? Peter,
Hey,
Peter,
yes,
would you like to share about the election opportunity?
sure. Let me just get myself up here. Why am I not showing up when I need myself to show up? There I am. Hey everyone. Really glad to be here with you today. Thanks to everyone who put this together. I'm just popping in for a minute here to say that we have a very exciting opportunity at SDA. We're going to be doing some phone canvassing around the election and framed around a deep canvassing model that is oriented towards long-term movement building. If you are interested in doing that with us, please, we'll have an application up soon. We'll be sharing the job description and would love to have you join us in that work. It's gonna be fun. You're gonna be getting to work with Ligia, me too a little bit, and we're gonna really push in the next couple weeks to make an impact in this election and make a difference with what we got. Very excited that we have this opportunity coming up. So please let us know if you're interested, and we'll be sharing the job description once it's ready.
Thank you, Peter. And we share again the fact sheet for the voting in care facilities. And we hope that you can all, share it, either print it or, email it to friends, to families, to everybody that care about this election. And also we have, and this is the one thing that we've been trying to do, and California Care Rationing, we've been trying to get Kaiser to share their guidelines for rationing care. And so far we have about 70 something letters, right? But we need at least 250 so they can see oh, this is for real. People are caring about this. So if you can, please go on the chat and click on the link that said actionnetwork.org. Letter Kaiser Stop Care Rationing. So you can modify that letter and submit. And then you can share it to all the friends, all the people that you know. And so we can get to the 250. That's an easy goal, right? Maybe we can even get 1,000 people with all of you. So please share that letter. And again, we also have the letter, another sample letter here. That's the sample letter, right, Jessica? For the care facilities. If you know anyone in a care facility, if you have a friend, a family member that live in one of those care facilities, please send them a letter. Let them know that you are observing them, that you know what they are doing or what they are not doing. And so please take a look at the chat and click on those links. And thank you for coming to our teaching, and especially thank you to our wonderful speakers. Hopefully we're gonna find some solutions. I know that a lot of you are sharing this information, and so I wanted to also thank our interpreter and our captioner This is great that we are trying to make sure that everybody that needs some access, you know, they get it. And so maybe in the future we can have Spanish translators. We can have, you know, I don't know, maybe Cantonese or Mandarin. We are trying to make it better for everybody. So please, if you're still in this action, in this event, click on all the links and share that information with everybody. Thank you very much. Jessica, would you like to say bye to everybody? No? Okay, I guess that's
Just
it.
thank you to everyone. Really looking forward to working with you all. We've got 3 weeks. Let's take action.
Yes. And don't forget to call us, you know, if you want to get more information about our voting opportunity. Thank you, thank you. Click on those links. Don't forget.